Thank you, Cathaoirleach. Cathaoirleach, I would just like to start out by saying I'm absolutely disgusted that the Minister has left this debate this morning. He has come up with a speech that has all the right words in it, and yet he will not be here to listen to women's voices and women's their opinions on this matter. And I'm really annoyed that he has left the debate and not actually given us the respect to listen to what we have to say on this issue. So I stand here today as a Social Democrat spokesperson for children. I stand here as Wicklow's only female TD. I'm actually here as Wicklow's only TD, despite both the Minister and the previous Minister for Health being my constituency colleagues. I stand here as a mother of 2 daughters. I stand here as someone who voted to repeal and campaigned to repeal, and I stand here as someone who fundamentally believes that women's healthcare deserves to be free from religious influence, that women deserve to have the healthcare that they need, that they want, when they need it and where they need it. And I am really angry now that the Minister is not here to listen to this. I'm reading the Minister's speech. In it he says, I'm going to specifically talk about the National Maternity Hospital, and I do thank you, Minister, for being here to listen to this today. I want to thank Deputy Connolly and Deputy Pringle and their colleagues for bringing this forward. It is a hugely important issue and one that the Social Democrats will absolutely stand behind. But I do want to talk specifically in relation to the National Maternity Hospital and the ownership of it. In the Minister's speech, he says that the legal framework will ensure that the health services at the new hospital will be provided without religious, ethnic or other distinction. That does not mean the services that will be provided will be without religious distinction. That means that they will not discriminate against people on their religion or their ethnicity in access to the hospital. He also states that he will not countenance any new maternity hospital that has any governance or influence involving any religious ethos, and services will be provided in accordance with the law and national policies. Now, that completely rings hollow, because this is the same Minister that a number of weeks ago said that there was no legal or policy reason or health reason why maternity care could not be given, maternity restrictions were required when it came to women's births at the moment under COVID, why there was absolutely no reason why their partners could not be in with them. The CMO has said that there was no legislative or health reasons why that could not happen. So it is clear that the Minister does not have control of what's happening in the hospitals across the country, because there are many women who have to face a very vulnerable position of going for healthcare, for giving birth, having their scans without their partner, without their support person. And it does not make any sense in a situation where we have people who very soon will be able to go to the pub and enjoy a pint, and yet women cannot have the very person that they need with them whilst they're giving birth. And so the Minister, whilst he's saying on one hand that he will make sure that the National Maternity Hospital, that they will meet all their legal and the national policy requirements, he can't do that when it comes to maternity restrictions at the moment. So I'm sorry, Minister, that absolutely rings hollow, and I am not taking it on word, because promises have been made on this repeatedly over the years, and you still have not, and your previous colleagues such as Simon Harris still have not actually provided the governance and the clarity when it comes to who's going to own this hospital, who's going to run it, and under whose ethos and influence it will, maternity care will be provided. 74% of people in my constituency of Wicklow voted to repeal. We did not vote to repeal on condition. We did not say that it was repeal for only some women in the country or for only some hospitals. Every single woman in this country, every single woman in our constituency of Wicklow deserve to have the health care that they need when they need it, and to make choices about their own body in accordance with their wishes, and not some puppet that's holding governance over them.